Good afternoon, everyone. May I have your attention, please? Our speaker today is David Kotz, who is from our Department of Computer Science. He is the champion international professor in that department. He currently serves as Associate Dean of the Faculty for the Sciences and previously served as the Executive Director for the Institute for Security Technology Studies for 4 years. In 2013, he was appointed by the GAO to the U.S. Healthcare IT Policy Committee. His research interests include security and privacy, pervasive computing for healthcare, and wireless networks. After receiving his AB in computer science and physics from Dartmouth in 1986, he completed his PhD in computer science from Duke University in 1991 and returned to Dartmouth to join the faculty. And please welcome our speaker.
All right. Thank you all for coming. I know that at this time of the week, Webster Avenue is beckoning. I had to walk down there to get here from computer science, and it's already packed. It's a big weekend, I suppose. It's my pleasure to come today and talk a little bit about what we're doing over on the other side of campus in Sudikoff Lab for Computer Science, and in my lab in particular. And the theme for today is all about the wrist and its possibilities for being a platform for mobile healthcare applications. And the phrase mHealth is all the rage these days. It's quite a buzzword, which means that it means nothing anymore. It's used so often that everybody has their own definition. So here's my definition, which itself is pretty broad. The use of mobile computing and communications technology either for the delivery of healthcare or for the collection of health information. And I've seen it used in both ways, for example, in epidemiological studies in sub-Saharan Africa or for clinical use in the US. And there are many reasons why people are interested in this technology in support of health and healthcare. Of course, the main being that we think, hopefully, that these technologies could improve health, help people be healthier or more well, more in a broader sense. Second, we could improve access to healthcare. For many people, the cost or the distance to appropriate healthcare is a major barrier, and so if we can lower the cost or make it easier for them to achieve or receive the services that they need through technology, that would be better for them. And then, of course, as always, we'd like to reduce the cost. And as you know, healthcare costs are getting to be extraordinary. So one use of mHealth is in the clinical setting. A very simple and common use would be smartphones and tablets used by doctors and nurses and physicians' assistants and other staff in the clinical setting. And that's becoming more and more common as hospitals and vendors prepare apps that allow them to use their electronic health records and so forth. You can go beyond that a bit then and take mobile devices and put them on patients directly for monitoring the patient in the ICU or in the ward, or why they move around, as a way of monitoring physiological or other conditions and providing the clinical staff the data they need. And of course, you can take that even further outside the hospital, send them home with some devices to continue to monitor their conditions post-surgery or post-heart attack or some chronic disease, so that they can stay home and not have to come back in regularly for checkups or tests, just to monitor blood pressure, blood sugar, weight, etc. At the far extreme, of course, in the consumer end, there's a huge amount of activity now in personal wellness, particularly fitness, but a lot of devices, wearable devices and apps that are aimed at the consumer market to help people be more fit, lose weight, stop smoking, etc. I've got my Fitbit Force, which tells me I've taken far too few steps today. I guess I've been working on the talk. And then the other place that people are really excited about is in the developing world. Again, this is often about scale and access. You have huge numbers of people, difficult distances and travel, little income, and very few health experts and health facilities. And so if you can use technology to increase the scale and reach of the system, that's good. So because of all this interest, there's a lot of development in new devices. Of course, smartphones are a great device and are very useful for health-related purposes, both by clinical people and by individuals, but also increasingly various special purpose sensors and devices that you might wear or carry or step on, like a scale, or even ingest or have implanted. There's an explosion in these kinds of devices. Here's a sampling on the screen. And as a result, there is an expectation that this market is expanding rapidly and becoming very, very hot. So I see almost every week, another blog posting about another startup, more VC money, more efforts to grow this business. In our group, we're interested in the security and privacy issues that come up when you use this kind of technology. If you're going to constantly or frequently be monitoring someone's physiological or behavioral conditions, reporting that and sharing that to electronic health records or health coaches or insurance companies or employers or even just to friends and family, you need to be very concerned about this. And the reason is that security is important because the data has immediate and very personal impact. The stuff that you're doing directly affects your health in some cases. If you're wearing an insulin pump that can give you a dose of insulin, and that's digital and that's wirelessly connected and it's controllable through your smartphone, as some of them are, then you should be concerned about that smartphone being hacked or that insulin pump being hacked, both of which have been demonstrated. And so that's why security is important. And privacy, not surprisingly, is also a big deal. The data is very sensitive. It's about your body or about your behavior and your lifestyle. There may be a large quantity of it. So today, your health data mostly is a series of 15-minute visits to your doctor or clinic 2 or 3 times a year. But now if you're wearing a device that's measuring at 20 hertz and recording all that information sort of nonstop, now you have tons and tons of data. The data is more diverse, actually, than just your monthly or yearly blood pressure, weight, height, and so forth. But it includes all kinds of behavioral information. How much do you walk? Where do you walk? Who do you meet with? How do you feel? And so forth. And of course, it can be used for a lot of different purposes than the relatively narrow set of clinical purposes we have thought of. And particularly in behavioral health, there's a lot of interest in interventions to help people change their behavior. So today I'm going to talk about 3 projects, again on this wrist theme. One called Zebra, one about biometrics, and one called Amulet. So I'll start with Zebra, which is a fun acronym. We can all celebrate Srirang Maria here, who came up with this acronym, Zero Effort Bilateral Recurring Authentication, and I'll tell you a bit why we came up with that term. The motivation here is for clinical environments, like a hospital. You go out to DHMC or virtually any hospital, and you'll see desktop computers here and there around the clinical space. And you'll see doctors and nurses and other staff moving around constantly, visiting patients, talking with each other, occasionally stepping up to a terminal. Maybe 60 seconds, they update a medical record or do a prescription, and then they leave. And so these are shared computers that are with frequently turning over users. And so the question is, how do we make sure that only the right people have access? And that every access is associated with the right person, because certain people will have authority that others don't. And also, just for compliance reasons, you need to be able to know who entered that prescription. And so the problem here is these computers are left open. Most people, or many times, people don't log out when they leave. And so the problem is not authentication so much. You can log in with a username and password or whatever. But deauthentication. You want to log them out or lock the screen when they walk away. And so one method, of course, is timeouts. After 30 minutes of inactivity, the system logs you out. But 30 minutes is a long time in such an environment. And if you crank it down to 5 minutes, sometimes that'll log somebody out when they're still working. And so that has been shown not to work well. So our approach is what we call continuous authentication. You want to continuously verify, is that person that logged in still here? And as soon as they're gone, or at least as soon as somebody else arrives, log them out or lock the screen. And so the idea is to have them wear a wristband that has an accelerometer or motion sensors, and it can communicate through Bluetooth to the to the desktop computer. And as they're working and typing and so forth, the wristband is measuring the wrist movement and sharing that with the desktop. Meanwhile, the desktop is monitoring the keyboard and mouse. That's its input, right? And it knows when you're typing and when you're moving the mouse. And as long as those things seem to correlate, then the user is still there. But if that person walks over to write on a piece of paper or work on another computer, and someone else comes up to the computer, their input on the keyboard and mouse will no longer correlate with the bracelet that's over here. And so you can log them out. That's the idea. And so here's an example. The blue curve is an accelerometer trace, magnitude of acceleration of the wrist of a user. And we've marked in the colored bars what they were doing according to the computer. They were scrolling or typing, or in these brief gray bars, their hand was moving, must have been moving between the keyboard and the mouse because it transitioned from typing to scrolling. And so you can see just visually, at least informally, that there's a difference between these different activities. So our goal was to train a machine-learned model to recognize from the hand movement, are you scrolling, are you typing, are you moving to the mouse? And so you can start with measuring this information. And on the one hand, the computer knows what is happening with its input devices, and it makes a list of the interactions. And on the other, your bracelet is measuring the acceleration and putting that through a classifier, a machine-learned model of how wrists move, and outputs a sequence of estimated interactions. I think you're typing, I think you're mousing, etc. And then you compare those. And as long as that correlation is strong, you output, I think the user is still the same user. And if it becomes weak, then you say, it doesn't look good anymore, and the system can take whatever approach you think appropriate, such as locking the screen or logging them out. So there are two things we would be concerned about here. Is this usable, and is it secure? Obviously, we want security. That's the point here. But if you are too aggressive at logging people out, that's not going to be usable. People will be frustrated, and the next thing you know, they're throwing away the wristbands and saying, forget this. And so we did a user study, or I should say Srirang did a user study, with 20 subjects, came into the lab, and they worked on the computer for a half an hour, filling out a web survey form, browsing the web, and at one point, watching to try to mimic someone else who is typing. The idea is, if I were an adversary and I wanted to take over your session, when you stepped aside, I would sneak up to your terminal and watch carefully what you were doing with your hands and try to do the typing and mousing that I need to accomplish my nefarious task so that it still correlates with your wrist movements. Tricky, right? We set it up with some advantage to the adversary to see how well an adversary could do. And so there are a couple ways to measure this, and I'm not going to go through all of the detailed data, but one way is how soon would you, or how long would an authorized user remain logged in? Ideally, they should remain logged in forever as long as they're at the terminal. If you kick them out, that's bad. And so in this graph, there's time across the x-axis and the fraction of the users who remain logged in at that time and the y-axis. And so you'd like it to be a straight line across the top. Everybody remains logged in throughout. But occasionally our system makes a mistake and kicks somebody out early. And so after about 6 minutes, 85% of users were still remained online. So you would want to adjust the parameters here. There's two parameters. I won't go into the details here. And we would need to improve this model a little bit. But it's looking doable. On the other hand, you want security. You want to make sure that if an adversary or the wrong person comes up to the keyboard, you kick them off fast. And so here we're showing the time that it takes for such a person to be recognized as no longer the right user and kick them off. And depending on the parameter here, there's two different cases. It's within 11 seconds. That's pretty fast. Or at worst, 50 seconds. And so we're in with these settings anyway, we can very quickly kick off someone who shouldn't be there, at the expense of occasionally kicking off somebody who should be there. This work is being presented next week, or the week after, is it, at one of the top security conferences, the IEEE Security and Privacy in California. The next piece is about bioimpedance, about a biometric. And this is the PhD work of my student Corey Cornelius, who finished last summer and who is now at Intel Labs working on biometrics, actually. And his joint work with many other people, including Ryan Halter and Joe Skinner here at Thayer. So the problem here is, how do you know who's wearing a device? So if you have a large number of mobile health devices and you can put them on your wrist or your chest or your foot or wherever they're supposed to go, you want to know who's wearing it. And there are several reasons for that. One is, if it's collecting data and putting it in your medical record, you want to make sure it goes into the right record. Or if it's a wristband that's used to authenticate you to a desktop computer, and it knows who you are, then it can automatically log you in, which would be really nice. So one approach people use is biometrics. And the classical physiological biometrics measure what you are as a human, as a body, because most bodies are unique in various ways. And technology has been used to, for example, scan fingerprints, scan the geometry of a hand, recognize facial features, or use retinal imaging to recognize these characteristics that we've identified as being somewhat unique. Most of those are fairly intrusive, though. In order to collect that information, the person has to do something, like scan their finger. And if we want continuous verification in some of these applications, and we want it to be passive, ideally, the person doesn't do anything. They just put the device on and it says, "Hi, Dave," right? That would be ideal. So one approach people use is behavioral biometrics. Instead of sensing what I am, sense how I do things. So one example that might be useful for this desktop example is your keystroke behavior. How do you type? If you've ever watched different people type, you've noticed that some people have very distinctive styles in terms of speed or pressure on the keys and so forth. And so if you can capture some of that information, you might be able to tell people apart just by their typing style. Voice, obviously. Voice is a distinctive characteristic, and voice recognition is one approach. Gait, you can sometimes tell people apart by how they walk. And so if you can measure their gait somehow, then you might be able to use that. And then handwriting, not just the end result, but how you write can also be distinctive. So people have explored all these. But again, we're looking for things that can be done passively, no action on behalf of the user, and unobtrusively. So you don't want to have a camera in their face all the time, right? Some of these devices don't have cameras. So what we're looking for are biometrics that have certain properties. Does everybody have it? Obviously, if they don't, then that's kind of hard to use. Is it unique? It has to be sufficiently distinctive to help us distinguish people. Is it permanent? So some behaviors change over time, or if you get sick or something, you might change, and so the biometrics that are not stable are not as useful. Unobtrusive, as I mentioned, and of course, difficult to circumvent. You don't want it to be easy for an adversary to pretend to be me. And there are many studies of face recognition systems that just given a photograph and put in front of the camera say, yeah, good to see you again, right? And so you have to be careful. So our approach was, again, for wearable devices, was to sense a property of the tissue, in this case, of the wrist. And so the property is bioimpedance. And what that means is that if you pass a current through the tissue, it impedes that current according to the nature of the tissue. Is it bone or cartilage or muscle or fat? And those have different properties, and they have different signatures as you pass a current through. And there are two ways you can measure that, at least. One is bipolar here, so you pass the current using two electrodes and simultaneously use those electrodes to measure the impedance. Or if you have a few more electrodes, you can pass the current with two electrodes and use two different electrodes to measure the impedance of that current going through the tissue. And so if you put this on a wrist, in our case with 8 electrodes, you can pass the current through the wrist in different directions, or not in different slices of the wrist, if you will. Between electrodes 1 and 5 is different than 1 and 3 because it's going through different tissues. And so if you pass current in all the different pairs and you do it at different frequencies, you get a signature that looks a little like this. So here frequency is varying on the x-axis, impedance is on the y-axis, and each curve represents a different pair of electrodes. And so each person's wrist is going to react differently and get a different graph like this. And so if you can record that information for the person you want to recognize, extract some statistical properties, features from this curve, then you could train a model to recognize that if it saw a similar signature again. So to do this, we built a biometric bioimpedance wristband. We started with a shimmer, which is a small, actually it's about the size of this clicker, small device that has a microprocessor, some memory, and a radio in it, and a couple sensors of its own, and it's open and expandable, and developed a custom daughter board to add on the bioimpedance measurement piece. And then Corey, and this is where Corey learned how to sew as a PhD student. Not a skill that many computer science PhD students expect to learn, but he did. So he sewed together this elastic wristband with some snaps as electrodes and made this 8-electrode device. And you can see, I guess you can't see my mouse, down here, this is the inside-out view of the wristband, and then this is what it looks like when you wear it. He tried to make it compact enough so that he could get volunteers to wear it for a day and measure every minute or so what their bioimpedance signature looked like. And so the idea is that you get somebody who you want the bracelet to recognize and you enroll them, meaning you train the bracelet for them. It records some samples and comes up with that graph like I showed you, extracts mathematical statistical features like slope and intercept and so forth from that graph and train a machine learning model. And then you save that model in the bracelet. And if you want the bracelet to be usable by 5 members of a household, you can train it for each of them. And then later, when someone puts on the bracelet, assuming the bracelet has some way of knowing it's been put on, it will make the same kinds of measurements and test them against each model and see which ones, if any, match. That's the idea. And then he got a bunch of volunteers to come into the lab and test this out and find out how well his approach works. And this is one of some many plots in his thesis. On the left-hand side, we're looking at balanced accuracy, which is a measure of the overall kind of average accuracy this method obtained. And you can see it's around 98% if you choose the right pair of electrodes and use this particular learning method, SVM. And another metric is the false accept rate. So that's how often did we falsely recognize someone when it wasn't really them. And that's nice and low. That's good and secure. And then on the far right is the false reject rate. So if it should have recognized the person but didn't, that's unfortunate. And that was a little higher, but still pretty good. The rightmost set is the nicest combination.
That's just one set?
One set of, in this case, there were 5 pairs of electrodes he used. And it takes a little longer to run through more pairs and more power. So it's a trade-off between accuracy and power and time. So like I said, Corey is now at Intel Labs and doing biometrics work. And he said, unfortunately, the problem he's trying to solve would be perfectly solved by this, but they don't want to pursue it. Guess why? Because we filed for patent protection on this idea, and they're scared. So we should talk to Intel, Ryan, and see if we can get them to do it. The next project is called Amulet, and this one has a fun name, Computational Jewelry, and I'll tell you a little bit more about it. There's a photograph there of this board, and if you're interested afterwards, you can come see our prototypes. And this project is pretty big. There's a large number of people involved at Dartmouth and at Clemson University. The fellow in the white shirt was a postdoc here and then went to Clemson, and so now we have 2 schools involved. The idea was to find a platform on which to run mobile health applications that was always with you. Now, if you walk around campus today, look at any undergraduate, they always have a smartphone, and it's always out in front of them walking around campus. And so a lot of apps run on smartphones. It's an obvious platform. But smartphones have disadvantages. They can be stolen, or they can be broken, or they might just be left behind. I know I do all the time. Mine's right over here, actually. It's not with me, so it's not able to sense me right now. So we want something wearable, and we call it Amulet because it's a nice name, and it implies protection, so that's nice. And the idea of Amulet is that it's a wrist-worn platform that stays with the user. It's literally strapped to you. And if you use Corey's technique, can authenticate who's wearing it It can be secured independently of the phone because it's physically separate and you can focus its development on security. And of course, it can provide an interface to the user. So this Fitbit has a very limited interface, one button and a small LCD display. But you could imagine gestural input or vibration as a haptic output. So you can have various methods of interacting with the user that are hopefully discrete and personal. Whereas if that smartphone were to display, don't forget to take your medication for, something embarrassing, and the person sitting next to you in the meeting sees that, it's not so private. And in our vision, it would also be talking to other devices on your body. So it becomes kind of a hub, an interface to and processing engine for wearables like a heart strap, chest strap, or a smart knee brace, for example. And again, our focus has been on security. So it has the nice thing about this platform, it has a small, trustworthy computing base. That means a small set of hardware and software that you have to focus on to make sure it's secure. You can build in secure storage for the crypto keys, custom or accelerated crypto hardware, and you could have this biometric authentication. And we envision it being part of a supply chain of vendors producing mobile health apps that are certified somehow, tested to be safe and secure and privacy preserving and all that, delivered to you through trust relationships you already have. So you go to your doctor's office and they say, I want you to use this Amulet application to monitor your health for the next month, and then we'll come back and look at the data. And here's the prescription, here's the application. Go to the pharmacist, and you trust me, and I trust the pharmacist, and therefore you should trust the application the pharmacist installs on your Amulet. And because it's focused on health, if there are life-critical applications, safety-critical applications, the operating system could be designed to focus energy, literally, on those if resources are scarce. And also, I think it would be useful as an emergency tool. So you've seen those bracelets, old-fashioned, metal ones, that indicate to a responder that this person has a particular heart condition or health condition they should know about, right? And this would serve in a similar role. It could be more fashionable, perhaps. But we imagine it coming off with a clasp. Here, the clasp is a USB port. So you just take the Amulet off, the responder does, and stick it into their responder's laptop or tablet, and out comes basic demographic information, medical history, and the last 30 minutes of your ECG or what have you. And so we hope that this would be useful. And in fact, one of the members of my team is an EMT. She's a first-year undergraduate, and she ran the entire ambulance service for Darien, Connecticut as a high school student. Amazing person. And the other undergrad on the team I should mention is here, Hillary. She designed the bracelet. And we'll see pictures, and you can see them here a little later. So we designed custom hardware because we couldn't find any commercial hardware out there that was small enough and flexible enough and open enough to let us do the research. And our approach has two processors. The main application processor runs the apps, and a coprocessor, much lower power, manages the network and local sensors. And the idea is that the application processor actually shuts off when it has no application to run. And that we expect to be probably most of the time. And so rather than sleeping the app processor, we actually shut it off, no power consumed. And the idea is that the I/O coprocessor would wake it up, actually boot it when necessary to process something, to get an app to process something. And so that means we need a very different software architecture. You're not going to run Linux on this because booting Linux takes a long time, a lot of power, has to restore or initialize a lot of state. So our approach is an event-driven finite state machine model for apps. Each app is a finite state machine. I'm in an initial state, and then when I get this kind of event, I transition to that state, and I take this action. So each transition has an event handler code, a small amount of C code that runs to completion. So when an event happens, the processor boots, runs the handler code, and then crashes, shuts down, turns off. And so each application is very simple. It's a state machine, which is a set of states and a set of handlers, a small set of variables, a little bit of permanent storage, and these event handler codes. And then an application, of course, sometimes needs services. It needs to ask for sensor data, instruct an actuator, like a pump or insulin pump to do something, store something, or communicate. And so the Amulet-based system has those services. You send an event to the communication manager if you want to send a message. And then, again, security is a big part of what we're doing this for. And so all of these requests that the applications make, events sent to other services, first go to the authorization manager. Are you, as an application, allowed to do that? You know, my fitness app shouldn't be talking to my insulin pump. And so there's a set of policies. It's not baked into the operating system or the apps. There's a set of policies that can be loaded, written in a logic language that say, this application, under these conditions, is allowed to do these kinds of requests. And that authorization manager logs every request and every decision in secure long-term storage. So that if you did need to audit later, here's this dead patient wearing an amulet. Why? What can the amulet tell us about what were the applications doing? Why did they get an overdose? And look through the audit logs. And the applications are written in C. Actually, the handlers, I should say, are written in C. And we've chosen a restricted version of C with a compiler that pre-checks all their activities for safety. We don't have any memory management or protection hardware to secure applications from each other or to secure the system from the applications. So the compiler checks ensure that the app can't write things it shouldn't write in memory or read inappropriately from parts of memory. And the nice thing about a compiler-based approach, compiler/language-based approach, takes no runtime cost. There's no extra runtime slowdown or memory or energy needed to do those checks. It's all done in advance. So we're developing a few applications to test out our ideas and find out how expensive they are in terms of energy, et cetera. One is a stress monitoring app. We work a lot with the Psychiatric Research Center here at Geisel, and they're interested in many things, but one of them they would love to be able to do is to monitor some of their subjects' stress. Measuring stress is really hard. There's no easy or universal way to do that, but we're, as a test case anyway, going to measure motion using the amulet and also wearing a galvanic skin response, the various sensors you can wear that measure your skin and its response, sort of sweatiness, if you will, and heart rate. And all this information is computed, is received and used to compute a stress level, and that's recorded. And later, the amulet could be used to support interventions. If we have a really good measure of stress and you want to intervene at times of stress, the amulet could take some sort of action, like calm down, please, now. And then smoking cessation, big issue. Still, a lot of people are smoking. A lot of people want to stop smoking and find that difficult. And if there are ways we can measure and understand smokers better or develop interventions, that would be helpful. In another project with the chemistry department and with Thayer, we developed a wearable sensor that is specific to airborne nicotine, which is a byproduct of tobacco smoking, and unique, basically, to tobacco smoking. And so if someone were wearing one of these sensors, maybe here, it could tell when they were in the presence of smoking, maybe themselves. And the amulet can receive that data and then start measuring their wrist motion. And if they're doing something that looks like this, then they're probably the smoker. And we can record that information and use it for research or interventions. Another app that we're trying to make is for knee surgery or knee injury recovery. If you can instrument a knee brace to know the angle of the knee, then you could either record that for later analysis, or you could intervene and say you're hyperextending, hyperflexing, overusing, underusing, whatever is medically relevant. And then finally, the emergency response app is there for EMTs to automatically extract information, as I mentioned earlier. If you're interested in that app, here's a little plug. Emily Green, first-year student, WISP student, is presenting that project next Thursday at the Wetterhahn Science Symposium as the final poster for her WISP project. So we've been developing applications and the hardware. So we have two versions of the hardware today. The first is a development board, which you can see up here. It's obviously not wearable, but it was available early and made it possible for us to start developing the software, test out some of the algorithms, get some early sense of energy consumption, etc. It has the two processors and some memory, and an ANT radio, which is a common radio for commercial radio for fitness devices, and another microprocessor, microcontroller for specialized RAM, FRAM, and a couple of LEDs for output. That's it. And then we made a wearable version, which unfortunately is not here. Actually, there's a dead version of it here. It's all covered in glue, I think. That one doesn't work. But the other workable ones are back in the lab because we have a paper due. And that one has very similar set of hardware in a much smaller package. We added a display, we added Bluetooth low energy, and a micro SD storage card, so you can actually store quite a bit of collected sensor data if you wanted to. In parallel with that, we were developing, or I should say Hillary was developing some wearable bracelets to put them into, and this is her display from last week's Digital Arts exposition at the Hopkins Center, showing the progress of her development of a bracelet that could house this electronics. And she started with 3D printed models and then eventually made those into a mold to produce these silicone silicone models that you can actually wear. This particular one was worn at the NSF booth at the US Science Festival about 3 weeks ago at NSF's invitation by some 12-year-old girls who were daughters of one of our collaborators, because the audience was mostly middle schoolers and they wanted kids on stage. And so that was kind of fun. And there's a photograph of that prototype here. And that was the sort of development version that we could use in the lab or in some of our user studies. And ultimately, we'd like it to be smaller, more compact, more comfortable. And this is Hillary's vision of how that might look. You wouldn't have a large LCD display, LED display, but you would have small lights, LEDs shining through these little windows that might indicate different conditions. So the nice thing about Amulet, in fact, the whole reason for building all this hardware is to research, right? We're not here to make a product, certainly not yet, but we want to answer some questions. And one of the big ones for me is interaction. How should this device interact with its wearer? And there's a huge range of possibilities. I mentioned some before, displays and buttons and haptics and gestures. Maybe you can measure gestures and that could be an input. And so one of these bracelets is off at Clemson now because our collaborators there are setting up focus groups to work with people, ordinary people, to find out what kinds of modalities would work for them, at least in some of these applications. On the other hand, we know that we'll never have enough interaction on the bracelet, so how could the Amulet connect to and work with other displays? The smartphone is an obvious one, if you trust it. A television is another one, right? If I can just somehow tap my Amulet on this television and then it shows my ECG in full living color, that would be nice. And so we're trying to think of ways, simple and usable ways, to tell, for the user to tell the Amulet, I want to talk to that TV, and not make it too easy for a hacker to convince the Amulet that it's a TV. Same with emergency access. You want to make it really easy and very reliable so an emergency responder can get the data when an emergency happens, even if the person who's wearing it can't consent because they're unconscious, right? And so there's some interesting questions around how you do that securely and yet don't make it possible for someone to do it while I'm just sleeping. And of course, security questions are probably our main interest. Obviously, we'd like to integrate this with our bioimpedance bracelet at some point, although right now I think that would be a large and complex integration challenge. And another question is, how do you detect that the Amulet has been removed or that it's been put on? And that depends on the clasp. Is there some way we could design a clasp that could tell the Amulet, now you're off, now you're back on? And not just that you've been reclasped, but you've been clasped onto a wrist as opposed to a nightstand or a bike rail or something. And I mentioned the audit trail. I want to make it really easy for application programmers to program this thing and to do it in support of strong security. So they have to, it's almost a no-brainer to record a good and usable audit trail. And similarly, I mentioned the policies. You know, these applications can have access to these services under these conditions. How do you express those conditions? And how do you provide the information to make those decisions? If you're going to put sensors in the Amulet, and why not? What kind of sensors? Should we add a heart rate monitor, a PPG, an SpO2, or something else? It maybe depends on the application, but I'm sure we could put more. And if you're going to have a lot of the sensors in there, that takes power to run them. And so you want algorithms to think about, when do you use the sensors? Could you have some of it dependent on the context, presumably? Like the one I mentioned so far, if the nicotine sensor says I'm in the presence of smoke, then only now turn on the inertial management unit and start sensing motion to detect wrist movement. Networking is an issue. These are networked. They could connect with other devices or with smartphones through Bluetooth or ANT. And again, we, as I mentioned with the television example, how do you do that so the person understands this is what I'm connecting to? And you want to capture that intent, and you want to do it securely with encrypted connections and not have people deal with PIN numbers or passwords or any of that stuff. NFC is another radio technology that's becoming very common, near-field communication, centimeter scale distances, but that can be an advantage because you can use that as a part of an intentional communication. If I put this amulet close to something and wait for them to exchange keys or something, then it means that I want them to communicate. And power, of course. This has to be ultra-low power. I would think a goal of a commercial version of this would be a 1-week lifetime while running multiple apps, so you only have to charge it once a week. And that requires a lot of attention, both hardware and software, to managing power. Some people have asked, could we harvest power? And there's a lot of interest in that these days. Ambient radio, ambient light, motion, thermal gradients, etc. Not our expertise, probably not in our project, but that would be an interesting angle. So there you are, 3 projects, all around the theme of wrists. And I don't know how that happened, but it did. Zebra is using perhaps a simple and off-the-shelf bracelet to authenticate clinicians to their desktops. Bioimpedance could then help us know who's wearing that bracelet, and then Amulet allows that bracelet to actually run applications and do interesting things for health. There's a lot more people involved. I've highlighted Srirang and Ryan and Hillary, and I'm not sure who else is here. Shaway is here. And I'm very thankful to all of them. It's a huge group, a lot of great people, all part of Dartmouth's Institute for Security, Technology, and Society. And of course, the funders, initially this was funded by TISH. This is my TISH project, Trustworthy Information Systems for Healthcare, and by SHARPS, which is a Health and Human Services grant. Both of those are over, so now we're focused on THAW and Amulet. And if you go to those websites, you can read more about those projects. So and in fact, please follow our blogs. We'd love to have you keep in touch. Thank you. Happy to take questions. Yes?
Did you see multiple amulets talking to each other, perhaps sending out an emergency signal, perhaps having certified ahead-time Good Samaritans that are allowed to receive certain signals?
That's a neat idea. I can see several possible applications for amulets talking to each other. Certainly, for example, between parent and child, or more generically, caregiver and patient, if you will, cared, to help them keep in touch with what's going on with each other. I can see that being useful. One of the things we want to do in the emergency response side is automatically detect emergencies in some cases. We have a fall detection app. You saw its state machine. You could build a heart problem detector if you had the right algorithms. And then the amulet could reach out to maybe its smartphone if it's present, or if it's not, maybe to other amulets or smartphones to get a message out, I'm in trouble, I need help. And that would be very interesting and a big security challenge, right? So, yep.
What are your thoughts, since you're using a flat memory model for the OS and physical access by USB for the emergencies type situations? How are you going to protect the OS in those cases? Don't give them what they should see.
Right.
It's more nefarious if somebody like me gets all the victims.
So maybe I should be repeating the questions. So you were asking, since we have a flat memory model, we don't have internal protections except this compiler-based technique. What happens when somebody connects to it through USB and therefore perhaps could go around all of that? Well, it depends what interface you put on the USB. So the most trivial would be to make it look like a DOS file system, right? And give whoever connects to it access to files. And that would be very simple and maybe not as interesting as a richer protocol-based interface. Right now, literally right now, we're programming a encrypted handshake protocol between the responder and the Amulet using identity-based encryption. And there, once you establish the secure session, you're making certain requests. And those requests are being responded based on the policies and also based on the credentials provided to it by the, in this case, responder. So there is no direct access through USB. Yep.
Could you detect the onset of sleep and warn a driver?
I'm sorry?
Could you detect the onset of sleep and warn a driver coming on?
Could you detect the onset of sleep and warn a driver? Yeah, I think that would be an interesting application. I've seen several research projects working on that generically. Some of them involve cameras. I haven't thought hard enough to know whether stationarity would be a sufficient indicator of sleep. Often when you're driving, your wrist doesn't move, if you're on the highway anyway. But it would be an interesting and useful application if it could work, yeah.
You might be able to develop an interlock that would prevent the car from starting if his alcohol level was too high.
Yes, right. An alcohol interlock, right. So that would mean, I guess, either you need a sensor for breathalyzing, for example, or you would need a drunkenness detector based on motion, perhaps. A lot of it boils down to what sensors do you have and how good are they and how distinctive are they in terms of separating that condition from others. Yes, in the back.
Yeah, you mentioned an ongoing project working on monitoring stress levels based on heart rate and skin. And I've also heard of applications that try to identify the onset of depression or other symptoms. I'm just wondering if you're worried about making clinical diagnoses based on just physiological data.
Yeah, so your question was about stress monitoring applications and the challenges of doing that well enough to perhaps use it for clinical decision making. And I would say, our particular stress monitoring app is very basic and is, I'm sure, not good enough to be used for any clinical or even probably research grade stress measurement at this point. At the moment, these apps are a proof of concept. Yes, the Amulet works, and it roughly takes this much time and energy and so forth to do these things. Once the platform is more robust, then we could pour energy, time into developing, more meaningful, more algorithmically or clinically meaningful applications. As a footnote, I would say, in general, if you're going to use these apps for providing indicators of, say, onset of depression, that would be an indicator. Then you would go, or for that matter, heart conditions, then you would go into the clinic and go through the usual clinical testing to confirm it, right? Because, I doubt these things are ready for serious clinical, decision-making at that level. Scott?
It seems Zebra would be important to put it on the wrist with which you do the mousing or something.
Yep.
Obviously, if you switch wrists, everything's going to change. Did you run into any cases where people just changed their behavior, for instance, used their keypad with their right hand while mousing with their left and got kicked off the computer for that reason?
So you're asking about which hand the bracelet is mounted on for Zebra, and obviously if it's not mounted on the mouse hand, then it's not going to work well, and whether someone changed their behavior. And I don't know whether you encountered conditions like that, but we mount, in the experiments, we put it on the relevant hand, the right or left hand, whatever they use for the mouse. Shirang, do you remember seeing any cases like that?
No, we didn't see cases like those, but we did divide the keyboard into two zones, like left zone and right zone, and based upon which key was pressed, we make an using inference so that they use the left hand or right hand.
You could use two bracelets for Zebra, but then you double your cost. So, another question?
Well, I can tell you if you use the wrong finger for the fingerprint ID that I have on my computer, it won't like me.
That's true. Yeah.
So you learn to always use the right finger.
Right. Yes.
On a related subject, I imagine in terms of behavioral considerations, these kind of false detects are probably important. People get kicked off the system when they should think they should have permission. They're not going to be here.
Right.
Do you have any sense of what the kind of tolerance level for those is? If I remember right, you had like 3 or 4% false detects sometimes where you were, or I'm not sure if you call it false positives or false negatives, but where You're
Yeah.
kicking somebody off when they shouldn't be kicked off.
Yeah,
How low does that need to get in order for people to be receptive?
right. Yeah, the question is about how sensitive are people to these false rejects, and how low does the false reject rate need to be in order for it to be successful? My sense is that it depends on the application. So if it's like a clinical login, logout application versus maybe a home computer, it would vary. It might depend on the workflow, so how quickly do they come and go? And it would probably depend on the penalty cost. So, for example, if I get logged out and all my applications are quit, that's a high penalty. If it locks the screen and I just have to re-enter my password, that's a lower penalty. And so it probably depends, and we have not done, that's a more complicated study. But it certainly is a key, I think, to getting these things accepted. Yep, right, Alex.
Or has it ever been raised in discussions about designing the system, resistance on the part of people who are not so concerned about the thing being hacked, but the fact that there is a permanent record of their every move, and that this may be accessible at some point by people that they don't care much for, like the authorities, for example.
Mm-hmm. Yeah, that's an interesting question. So you asked about if this device does record a lot of information in a semi-permanent form, then people might be concerned about it becoming available to those they don't want it to come to. And I can certainly see that it opens an interesting privacy research problem for us, right? So how can we make good use of the data for the purpose that the person wants, and yet ensure that it's either unusable by some other party or automatically destroyed, for example, if it falls into the wrong hands, maybe. Now, you can imagine different methods to perhaps provide that property, but I don't know what it is off the top of my head. Yeah, interesting problem.
If there are no more questions, thank you very much, David.
Thank you.